Dr. Scott Sherr.
That's me.
Welcome to the Gnostic Media Podcast.
Thank you, Yanya. Thank you for having me, of course. It's nice
You're
to
welcome.
be here.
And I met you at Dave Asprey's Bulletproof Conference. You were one of the presenters there, and I forgot to reclose my Outlook, and now we're getting dings already that just got recorded, so close that. I apologize for the ding already. But I met you there, and you and I talked for a little while at the conference, and we had a good conversation a couple of weeks ago when I wanted to bring you on to discuss hyperbaric oxygen therapy, ketones, diet, and all of that good stuff. And I interviewed, Dr. Kate from the conference who presented on vitamin K2 a couple of weeks ago. You and I had actually tried to get this thing going, like 2 weeks ago, and things just kept slipping by on both our ends.
It's been a process, but we're here. We're here. It's nice. It's nice to finally be here.
So welcome, and would you like to start off by telling us a little bit about your background?
Sure. Yeah. Again, thanks a lot, Jan, for having me. It's been a process, but we're here, and I'm excited. We had a great conversation at the Bulletproof Conference. It was a great conference. I really had a good time. I think just the number of speakers there and just the diversity of the topics, even though it was all about being, quote unquote, bulletproof, was really quite good. And
Well, what I wanted to say is, and the fact, that Dave didn't just have speakers who agreed with him and his point of view.
Right,
I mean, he actually had a pretty diverse collection of speakers there,
right.
know.
Yeah, which is great. Yeah, which I really appreciated. So my name is Dr. Scott Sherr, as you aptly introduced myself. I'm an internal medicine doc. I'm also a hyperbaric physician in San Francisco. I also do a little bit of consulting work around the country for hyperbaric oxygen therapy. I did my training for medicine at the University of Maryland in Baltimore. And Baltimore is a great city. It gets kind of a bad rap because of a show that was filmed there not too long ago called The Wire. Have you ever seen The Wire, John?
That sounds really familiar.
Yeah, it was an HBO series a while back, but anyway, my experience in Baltimore was a really interesting one, a really very, I guess, diverse one, you could say. The training was really good, and one of the places I worked was a place called Shock Trauma, and at Shock Trauma there is a hyperbaric oxygen therapy chamber in the basement. It's gigantic, and it was my first experience with hyperbaric therapy, and I saw these guys getting in there with a number of pretty significant issues: carbon monoxide poisoning, acute traumatic ischemias, or basically limbs are hanging off, or thermal burns, necrotizing fasciitis, or what's also called, I think, in the lay press, flesh-eating bacteria. It's a little bit more sensational to call it flesh-eating bacteria.
Right.
But anyway, they were going to the chamber, and these guys would come out looking great. I mean, maybe not after one treatment, but after a course of therapy, they get dramatically better. And then my mind kind of started going off, like, just light bulbs, right? Because my goal going to medical school was to try to find a way where I could bring together both allopathic or Western medicine with alternative medicine as well. And my mind started asking these questions, why aren't we using oxygen, which is a non-lethal, non-toxic, very few side effect modality for other issues? And then I started doing more and more research, and I got to the point where I was so interested that I actually got certified in hyperbaric therapy. And when I ended up coming out to California a number of years later, I started working as a medical director at a place in San Francisco. And I still do some work there. And I also do some work in New York and across the country, talking about hyperbarics and also doing consulting work for hyperbaric oxygen therapy. So that's how I got into it.
Great. So why don't we start off into the history of hyperbaric oxygen therapy? Why don't you give us the whole history of it?
So hyperbaric therapy has been around for a long time. Before we could actually compress oxygen into tanks and put it into a chamber or use compressed oxygen for anything, which only really started, I think, back in the 1930s. The first actual use of hyperbaric oxygen or hyperbaric air at the time was just basically using organ bellows that they used to use in organs back in the day in churches. They just modified them. This guy Henshaw in the 1600s, basically. There's these crazy, you can actually find them online, he was using organ bellows to either suck air out of a chamber, that was completely closed, or pump air into a chamber. So sucking air out would make it hypobaric, hypo, or make it, or actually put air into the chamber, and that'd be hyperbaric. And for about 200 years, that's how hyperbaric therapy was administered. And the thought before there was much research behind it was that it was the hypobaric conditions, which are sort of the corollary to that is like being an airplane or being above sea level, like on a mountain or something, would treat chronic conditions, and hyperbaric would treat things that were more acute in nature. It wasn't until bridge building, actually, and the Brooklyn Bridge is being the most famous example in the 1880s, where they started describing what was called at that time the bends, or decompression illness, as it soon became named back in the 1900s. These guys would be sunk down deep underneath the ocean in these things called caissons. The caissons would be these disgusting places to work where they got paid very little money. And what would happen was they would be in these compressed air environments. And the reason why they compress the air down there is to keep everything out, keep the water out, keep it as clean as they could.
And keep
They
it
have
from
these,
crushing too, I would imagine, right?
right, exactly, from crushing down underneath right, from the pressure of being underwater, basically. But what would happen if these guys came up too quickly from these caissons, they'd get these severe neurologic symptoms, seizures, severe, paralysis, and they would even die. And about 100, I think they described about 100 cases during that time, that particular bridge. And it wasn't really discovered until the Navy started using diving as one of its major roles in the 1930s that, if you put somebody in a hyperbaric chamber after they came out of one of these caissons, or if they came out from diving, their symptoms would go away. They would return to normal, and they wouldn't have any lack of function. So it was really because of that that hyperbaric oxygen therapy became became a medical therapy, when they realized that it treated decompression illness. It treated these patients. What it basically would do was it would basically put them back under the conditions that they were just in, to reverse the symptoms they just had. And it was basically at that point in the 1930s when they were able to compress oxygen into canisters and use that, pump it into chambers. It became hyperbaric oxygen therapy using 100% oxygen. And because that was much more effective, using 100% oxygen in the chambers along with the pressure to get these guys get their symptoms to go away, basically. So that was really the birth of hyperbaric oxygen therapy. And they realized that, wait, why aren't we doing this for other things? Why couldn't 100% oxygen in a chamber with pressure work for other indications as well? And that's been occurring since the 1940s and 50s, when they started using it in operating rooms, actually. They started using it for patients with burns, with patients with carbon monoxide poisoning. And really in the last 20 or 30 years, it's become more standardized as to what we can do with hyperbaric oxygen therapy. And in the last 5 to 10 years, how little we actually knew versus what we, in the respect of what we're actually using it for now in an investigational way, and seeing some dramatic improvements in patients throughout multiple courses of so many different types of disease processes, I guess.
All right. So, what is the HBOT, or hyperbaric oxygen therapy? The definitions, mechanisms of action.
Right. So the way it works is there's two things that are going on. There is 100% oxygen, and there is pressure. So the standard definition is 100% oxygen, the intermittent administration of 100% oxygen in greater than atmospheric conditions. It's all based in diving medicine, as I sort of described.
Now, would you, I suppose in your practice, you would end up treating divers and things as well in all of this?
So divers usually need to be treated in one of two places, either in hospitals or at the actual diving place that you're diving. So like, Catalina Island has their own chamber. A lot of diving meccas around the world have their own diving chambers. The reason for that is that these guys can be pretty sick sometimes. And also they have to go down to pretty deep pressures. Most of the outpatient or the clinic-based hyperbaric chambers, the ones that I'm involved with, they don't usually go down to that deeper pressures because it's not really safe to do in a non-medical environment. in
Okay.
a basically an outpatient environment, I should say.
And also, I would suppose you could accidentally cause the bends in someone if you had them, And I was a scuba diver for years too, so
Right.
you have to study all of that. That's huge, and how minutes you can stay under for every 5 or 10 feet, of depth that you go down. So yeah.
Right, right. You have to be absolutely be careful because what you're doing with a lot of these divers is you have to take them down back to where they were diving. So if they were at 6 atmospheres of pressure, I mean, which is a lot of pressure, 6 times 33. I mean, you're not usually that low, but I mean, if you're like 90 feet below, you have to go back down in a chamber to 90 feet below to get all of those symptoms to go away. Which leads me to sort of maybe to describe a little bit what's happening with decompression illness, and it goes along with what's happening with hyperbaric therapy. So, 100% oxygen under pressure. What you're doing with that pressure is you're basically forcing oxygen into the plasma of your blood. Okay. Typically, oxygen is carried with our red blood cells in our body. If you put a pulse oximeter on somebody's finger when they're going, to a doctor's office, that's usually going to read somewhere between 95 and 100% oxygen saturation. That's correlating to is how many sites on your red blood cells are bound with oxygen. Okay, so if you're just breathing oxygen in our air right now, which is 21% oxygen and then mostly nitrogen, most of us are doing just fine with our red blood cells, saturating those. Okay, so the question is, what can you do extra? And the extra that's we're getting in hyperbaric conditions in pressure is actually in the plasma itself. Okay, and the way you're doing that is something called Henry's law, which is physics. The more oxygen, the more pressure you have on oxygen in this case, the more oxygen is actually going to be dissolved into the liquid of our blood, into the plasma. Okay, so the opposite is true when you're going in the reverse condition. In this case, we're talking about decompression illness. So if you're taking somebody up too fast, if you're coming up from pressure too fast, you can bubble out nitrogen. Okay, and that's what's causing decompression illness. Those nitrogen bubbles are actually blocking circulation. When they do that, they're causing ischemia. They're causing tissue death because they're blocking blood flow. And that's what's causing all of these symptoms with decompression illness. So what you do is you put somebody that has decompression illness back in a hyperbaric chamber, you get all those nitrogen bubbles to go back into circulation using Henry's law in the reverse, and all of those symptoms go away because you're no longer blocking the blood flow.
And then you just slowly decrease the pressure, and then as the bubbles are flowing out, then everything returns to normal. Then you're at
right.
normal atmospheric pressure, and then they're free of it.
Exactly. That's exactly what happens. And exactly, the key is to do it slowly, because not only are you getting those bubbles to go back into circulation, there's also these other effects that are happening with hyperbaric therapy. You're also decreasing the whole cascade of inflammation that happens when you have ischemic tissue, when you have oxygen not getting to tissue.
So then the idea with using pure oxygen when you do the therapy is that there is no nitrogen in it to cause these in that case, accidental problems.
Totally, that's exactly right. Exactly right.
Okay.
Yeah.
All
So
right. Sorry to interrupt you. Go ahead.
no, that's exactly what I was going to say. So that's the key to hyperbaric therapy is not only using oxygen but using pressure, because you can't get that oxygen into your blood flow, into your bloodstream, without the pressure. I think sometimes people say, well, why can't I just put on a nasal cannula, like at an oxygen bar, for instance, or people get oxygen concentrators for their house. It doesn't have the same effect because all that's really doing is going to supersaturate your red blood cells, which are pretty much already saturated at baseline, right? So it's not doing a whole lot. I mean, it's doing a little bit.
Well, you do get high off of it.
Yeah, to each their own. Maybe it's,
I tried it once. It was at the conference. That was the first time I ever tried it. I just got a buzz off of it for about 10 minutes.
yeah, because what it is going to do is going to supersaturate all those red blood cells. So on a red blood cell, you have 4 binding sites for oxygen, and you're going to supersaturate all of those. And then you're probably going to get like a little tiny bit more in your plasma in the water of your blood, but not very much, very minimal, and it's not going to last very long. But it might make you feel a little bit different for a couple minutes. It's definitely not going to hurt.
Well, that's good to know.
Unless you have an underlying problem, like underlying lung disease, and then potentially. But I mean, unless you have uh, problems with, like if you have COPD, if you have emphysema, if you have a history, if you have a problem with your lungs, like a restriction defect or a diffusion defect, it can cause trouble. But for the most part, if you're a healthy individual, it's not going to cause you any trouble.
All right, so why don't we go into the FDA approval of hyperbaric oxygen therapy, and what do you call it? HBOT?
HBOT is the easy way to say it. Yeah.
Okay, go ahead.
Um, so the way I like to just to kind of break it down is that and I sort of mentioned this a little bit before. There's a number of conditions that are approved by the FDA and approved by what's called the Undersea and Hyperbaric Medical Society for treatment that is covered by insurance, covered by Medicare, all the private insurances as well. And there's a number of others that are, it's a much longer list, as you'd imagine, that are what we call investigational, where there's a lot of data behind it, but it hasn't gotten to the point of being fully accepted by those in power to accept these things. And, of course, there's lots of politics behind this.
I was just going to say, is the only approved use in treating the bends.
So, no, there's about,
I'm just kidding.
yeah. But I mean, if you're looking at the correlation or the ratio of how many are accepted versus how many should be, it's probably similar into what I'm going to be describing, right? So 1 to 16 or whatever. But so there's about 16 different FDA approved indications. About three-quarters of those can only be treated in a hospital setting because you need to be monitored pretty closely. Those include things like carbon monoxide poisoning, necrotizing fasciitis, like I mentioned, flesh-eating bacteria, thermal burns. We're talking about third-degree severe burns, acute traumatic ischemias. These are things that are usually seen in like car wrecks where you need to get, filleted open one of your muscles or one of the fascial planes in your leg because there's too much pressure, or one of your limbs is hanging off sideways, or you can use surgical recovery. They can help with surgical recovery in those instances. The two major things that I treat in the office that are more stable are diabetic foot wounds, diabetic wounds that don't heal, and radiation injury. So for the radiation injury aspect of it, these are usually patients that have had cancer in the past and that have been radiated for it. Okay, so we're talking about patients that may have, the most common, I'll just give you a list, are patients that have had brain tumors and then have had radiation from brain tumors. They can get something that's terrible called radiation necrosis of the brain, which over time can cause severe dysfunction and disability, anything from motor dysfunction to cognitive dysfunction. And the radiation just tends to eat away the blood supply over time, and over time, the neurologic tissue to go along with it. It's pretty severe stuff. The most common radiation injury is actually radiation injury to the jaw. And this happens in patients that have had head and neck radiation for head and neck cancer. So these guys will have the mandible itself is very sensitive to radiation. And what radiation is actually doing is obliterating the vascular bed behind the area that's being radiated. So one of the ways radiation works is by obliterating vascular supply to tumors. It does that to regular tissue too. So if somebody gets one of their teeth removed after they have radiation to that area, that tooth bed may not heal and may cause vascular damage and may cause vascular death and then bone death. So that causes it's called necrosis of the jaw. It's actually one of the ways, or one of the major, the history of hyperbarics belongs to some degree in the radiation world to osteoarthritis necrosis of the jaw because it's so common. It's been around since the 70s. So hyperbaric oxygen therapy has been used since the 70s to improve radiation necrosis to the jaw. Other areas include mastectomy patients for breast cancer, patients with prostate cancer, GYN cancers. All these guys get radiation injury. Not to a large degree anymore, thankfully, because radiation's gotten better. But we're talking radiation injury rates somewhere around like about 10% or so. And when I'm talking about improvements, I'm talking about 85 to 100% improvement using hyperbaric oxygen therapy, which is pretty dramatic. It's one of the most dramatic improvements that we see with hyperbaric therapy because we're really making that whole wound bed heal. Um, the mechanisms of action with hyperbarics are various, but one of the things that it does, the two major ways we think it helps in radiation injury are is that it stimulates bone marrow to release stem cells and to migrate to areas of injury. And we've quantified this. To exponential forms, it can do this, and it also causes angiogenesis, or where the blood vessels can regrow in areas of tissue injury. So these two mechanisms, plus actually decreasing the scar formation or fibrotic tissue formation, are substantially important in healing radiation injury. There's no other way to heal radiation injury except for using hyperbaric oxygen therapy. There's nothing out there. This is the only way. So that's radiation injury. And diabetic foot ulcers or diabetic foot wounds is probably the most underutilized and most effective hyperbaric oxygen therapy treatment.
I have an uncle who's actually lost both of his feet due to diabetes,
Yeah.
and I think you and I actually talked about this before too. There's this whole underlying dietary issue that is going on with that, and obviously Dave Asprey's stuff covers this as well. But so that leads to one, and then maybe a small portion of those end up at your, as someone like you for treatment of that.
This is there's this like the problem of our time, right? I'm going back to diet, but diabetes, I think last statistic I saw, I think 75-80% of the populations in this country is going to have it in 20 years. I mean, it's crazy, right? Maybe not 20 years, maybe 30 years, I can't remember, but I mean the trajectory is just amazing.
What do you think with how fast the information of paleo, high fat diet, gluten free, that sort of thing? Do you think that's going to have a big impact in heading that 30-year prediction off?
I really hope so. I really, really hope so, because that's really the answer. What I'm doing in hyperbarics is I'm saving people's feet. I'm saving their toes, their limbs, if they can get to me. What happens a lot of times, like your uncle, is they've already had one limb chopped off, and they come in, and I save the other one, or I save a couple toes on that foot, and they ask me, why didn't somebody refer you to me the first time? And I have to just nod my head and say, I don't know. But I think the answer is manyfold. I think number one is an educational issue. I think a lot of podiatrists don't realize what we can do, and a lot of vascular surgeons. But it's also a bottom line issue. Unfortunately, it's a reimbursement issue. What are they going to get reimbursed for, right? They're going to get reimbursed for cutting off somebody's foot or toe, and I hate to say that, because I don't think that's the majority of
Sure.
podiatrists and vascular surgeons.
Well, obviously, there are some that want to serve their own best interest, but I mean, at least see the person, and then you have an appointment or two, and say, I think we need to refer you to an HBOT guy. What do you call yourself? What is it
I
called?
just hyperbaric physician, HBOT, whatever.
Okay, hyperbaric physician. But I mean, he would still get his take from the insurance company or whatever.
Well, not how much the surgery costs and how much they get reimbursed. I mean,
Well,
that's the
yeah,
issue.
that's a good point.
Yeah. So that's the perverse incentives of our entire healthcare system, right? So we pay for sick care, we don't pay for well care. You get paid as a physician. I get as an internal medicine doc. You don't get paid to listen to somebody's lungs or prescribe them a diet. You get paid to chop off their leg, or do brain surgery, or put their heart back together after they've eaten a terrible diet over 50, 70 years, right? So
Right. Well, and that's the whole dichotomy between naturopaths and geez, what's regular doctors are called? Geez, I just forgot the name.
allopathic doc.
Allopathic. Thank
Yeah,
you.
yeah.
Just that.
Western docs, whatever you want
Right.
to say. But
Exactly.
I mean, there is a change. There are things happening, as you said, with the dietary stuff, with Dave and with Mark Hyman, and there's all these other guys that are talking more about paleo lifestyle and understanding the role that I think you and I both believe is that grains have really made on our healthcare system, and just the burden that's happened because of the change to like the low fat landscape over the last 20 or 30 years. I do think that things are changing. I mean, there is something called an integrative physician now that are MDs. So I do think that the paradigm is changing. It's just going to take time. And I mean, I think you and I spoke before, Jan, about how your forays into the high fat world was how long ago? Did you say like 3 or 4 years ago or 5 years ago?
Yeah, well, I started on bulletproof coffee in February nearly 3 years ago, and I haven't missed one day actually since. And I was in pretty bad shape. I had to go to Peru and get treatment down there for 15 years of stomach problems.
Right.
Almost died in the hospital down there. And then let's see, when I got back, I started having a relapse, but without the pain. And that's because when I got back to the States, of course, there was gluten and everything. And then about a year later, I interviewed Dr. William Davis, and then he started helping me through a lot of that. And I had him on the show. And that was really, a huge help in getting the weed out of the system. Everything started going from there. And then over the last year or so, I've started taking, the natural stacks and Dave's collagen and whey powder and stuff. And then that's really additionally helped the recovery of my stomach.
Right. And I think I think the paradigm is shifting a little bit. I mean, I think we're people that have drank the sauce, the Kool-Aid to some degree, but I think having these kind of podcasts and I think it's going to become more mainstream. I think it has to, because I think if things continue the way they go, the way they're going right now, it's out of control. I mean, I'm happy to help these diabetics. I'm happy to get these wounds to heal, and my goal is to save feet and save toes and improve lives, and that's why I got into this thing. That's why I got into being a doctor. But the key is to stop it before it happens, if we can. And
Well,
so,
well, I was just going to ask you, speaking of that, why don't we get into the investigational indications that would, enable you to catch it, as early as possible?
well, yeah. I mean, I think a lot of what we're doing in hyperbaric oxygen therapy is putting out fires, and I think how we're doing that is by decreasing inflammation, and like dietary changes that are decreasing inflammation. Hyperbaric oxygen therapy is like an exponential, like synergistic, like improvement on anything you can do dietary, especially when it comes to inflammation. There have been some studies that actually the studies that I'm referring to are the ones that actually were done in animal models of inflammatory bowel disease, like ulcerative colitis and Crohn's. Hyperbaric oxygen therapy is as effective as steroids at decreasing inflammation. Now, do we want to be using steroids? No, but they do have a purpose in decreasing inflammation in the right setting. Just like a lot of therapeutic modalities in allopathic medicine and Western medicine have. For acute injuries, for acute traumas, you need to be at a doctor's office. You need to be in a hospital. You need to be on medications, all of those things, a lot of times. But in the long term, those aren't necessarily what you want to be doing. Like, you want to be using dietary interventions. You want to be using things like hyperbaric oxygen therapy to improve your immune system function and decreasing inflammation, and being a synergistic, like basically a synergistic way of approaching health. And so when we're talking about investigational indications for hyperbarics, there is so many of them. But the ones I think that we have the most research and data behind, ulcerative colitis and Crohn's disease are definitely becoming more and more studied, and there is a significant improvement in these patients' lives with hyperbaric therapy. And I think the reason for that is not only is hyperbaric an anti-inflammatory, it's also an anti-infective. A lot of these guys are probably harboring some low-grade infectious organisms in their guts that hyperbaric oxygen therapy is probably being effective at treating.
Your description there sounds like my life for 15 years.
Yeah, I mean, and the gut is where everything starts, right? So
Right.
this. So ulcerative colitis and Crohn's, the studies that have been done in like refractory patients, right? Patients that have been refractory to all different types of therapy, no more hope, and they get hyperbaric oxygen therapy, and then they go into remission. Like they don't need drugs, or if they do need drugs, they're at vastly decreased doses to what they were using before. Um, so that's inflammatory bowel disease. There's others as well. The most common that I see are patients with traumatic brain injuries and patients with previous strokes. Traumatic brain injury is, I think it's the number one cause of morbidity or disability in people that are less than 45 years old. And stroke is everybody. Stroke is the most common type of reason for disability for people under people any age, actually. So hyperbaric oxygen therapy. Sorry.
Didn't strokes not used to happen in people under like 45 or 50, and now that has dramatically now like 6-year-olds are having strokes or something?
I mean, the curve is it's flattening out. Instead of being a rise like this as you get older, and like, very, very actually sort of more like this and then sort of like that. Now it's more like this, right? So meaning that people at a younger age are having these things happen to them. And what I see is where I work is the patients that have had these downstream effects, that have had the stroke, that are disabled. And what hyperbaric oxygen therapy can do is it can improve the lives of these patients dramatically. Now, it depends on the patient. Some patients do dramatically better. Some patients only get about 10 or 15% better. And I can only say that the patients that have had the incident or had the trauma or whatever it might be, the earlier it is that they get treated after that, the better that they do, right? So the longer that it's been since you've had the stroke or since you've had the traumatic brain injury, the more likely that you're going to get less function back. But the earlier you get treated, and actually there might be a window too where you don't want to get treated. There might be a window for about 3 months or so that you want things to kind of stabilize out before you actually get treated. So the sweet spot is really not clear, but it's probably somewhere between 3 and 6 months post-event. And then the further away from the initial incident that you get treated, the more complete of an effect hyperbaric oxygen therapy tends to have. But we're talking about motor recovery, we're talking about cognitive recovery, we're talking about in traumatic brain injury patients, improving their ability to think, their ability to have visual spatial recognition, their ability to have a job, to not have headaches, to not have nightmares. A lot of these guys that are coming back from Iraq and Afghanistan not only have TBI, traumatic brain injury, but they also have PTSD. And a lot of that is related to their TBI, we think, because if you look at their brain under functional imaging, you can see the areas of injury, and you can see what hyperbaric oxygen therapy is doing now, because we can do studies and show their brains changing after getting hyperbaric therapy. And the areas where their brain changes, where their blood flow improves, correlates to how these tests that they're doing. We're doing, quality of life scores, other types of cognitive or activities of daily living scores, and we can see on these tests how well that they're doing in certain areas, and we can correlate that to areas in their brain where their blood flow is improving. And the mechanism behind that is blood flow and revving up these areas of the brain that are probably stunned or not functioning as well as they need to after a stroke or after a traumatic brain injury, where you have this area of tissue death. But you also have this area around that tissue death where you probably have what we call in medical terms hibernating brain or stunned brain, this area around the area of tissue death where the cells are still alive, but they're just not functioning at maximal capacity. And you can see this on these functional imaging scans. The one I'm talking about mostly is called a SPECT scan, SPECT. And you can see there's the area that's not getting any blood flow, and then there's an area around that sort of graded from that as far as how much blood flow it's getting. And that tissue is not dead, it's just not getting enough blood flow. Then you give them hyperbaric oxygen therapy over a course of a couple months, and that blood flow can dramatically improve. And that's what we're seeing. That's what we're starting to document now. So it's dramatic stuff that I'm seeing.
All right, let's see. Why don't we get into the controversy surrounding TBI? Explain to us what TBI is.
Okay, so TBI is traumatic brain injury. And there's lots of different grades of traumatic brain injury. There's severe and there's mild. Mild traumatic brain injuries are the most common. These are the ones that we're seeing in football players, we're seeing in athletes playing collegiate sports, or even playing in intramural sports. These guys typically have a concussion. The concussion can be mild, it can be severe. Usually, to have a post concussive syndrome or mild TBI that lasts longer than just a couple days or a couple weeks, it's usually related to a pretty significant concussion where you've lost consciousness for a brief period of time, or you've had severe symptoms at the time. And what happens is it's a gradation of injury, like I was mentioning, but the most common is the post-concussive syndrome, where you have this inability to use what we call executive function. Executive function is what's in our frontal lobe, right? So when we have a traumatic brain injury, a lot of times what we're doing is hitting the front of our head, right? We're hitting our front of our head, going back and forth, right? So you hit the front and you hit the back. At the front of your head
So
is
that would be like soccer players and rockers, right?
yeah, soccer players. It can happen in blast injuries, the same kind of thing in veterans coming back. It can happen in patients in motor vehicle accidents. Those are really common. And so the drugs that we use for traumatic brain injury are basically patches, okay? They treat the symptoms, which are headache, inability to concentrate, anger issues, violence, and this correlates. It's been in the media all over the place. You have NFL players now, unfortunately beating their wives in elevators, their kids. Um, eh, these are personality changes that are probably happening from traumatic brain injuries over time. And what we're doing with drugs is trying to decrease the symptoms. They're giving them antidepressants, antipsychotics, migraine medicine, but none of this is really getting to the root of the problem, right? Um, and I should also say that traumatic brain injuries aren't only affecting cognitive function, but they can also affect physical function, motor function too. Severe traumatic brain injury patients can be on ventilators. They can be in vegetative states. It runs the whole gamut. Um, so hyperbaric oxygen therapy is now being studied for traumatic brain injury. And according to the new literature out there, if you read the lay press coming out of the studies that are happening at the VA, the Veterans Administration, you would think that hyperbaric oxygen therapy is ineffective for these patients. But the answer could not be more the opposite. In fact, we're seeing such significant improvements in these patients getting hyperbaric oxygen therapy. And it's all in the eye of the numbers and how you decide you want to define who's getting better and who's not getting better. The answer is actually pretty simple. Most studies that are done in the regular in the medical world are what are called placebo-controlled trials. Placebos, for the most part, are supposed to have no effect, right? The idea is that you're comparing a treatment to a placebo and a treatment that's, quote unquote, ineffective, right? So it doesn't work. The idea is that the person getting the treatment, though, can't tell the difference. They can't tell the difference between getting the treatment or not getting the treatment. So in a hyperbaric oxygen chamber, that's not as easy to do as it is taking a placebo pill, a sugar pill, versus not taking a pill. To give them the exact same experience of being in a chamber and getting hyperbaric therapy and not. Okay, so what these guys have done, and actually there was just a recent study that was just published with the same thing, which drives me nuts, is that they're comparing hyperbaric oxygen therapy at 100% oxygen at a certain pressure to hyperbaric air therapy at a different pressure. Okay, and they're saying that second pressure is a placebo, okay? Or they're not saying placebo as the word, they're calling it a sham pressure. In their words, they're basically calling it a placebo, saying that it has no effect, okay? But what they're doing is they're using this sham treatment And their definition of that is 1.3 atmospheres of pressure with compressed air. Okay? So if you compress air at 1.3 atmospheres of pressure, what you're actually doing is increasing blood oxygen by 50%. Okay? Would you think that is a sham treatment? Does that sound like it has no physiological effect?
No.
The answer is absolutely not. So what they're doing is they're comparing this sham treatment to a hyperbaric oxygen therapy with 100% oxygen.
So then you're already going to have this much advantage from just regular air, and then so the increase from oxygen therapy itself would be less. It's not a true 0 point to compare to.
It's not true zero at all. So we are absolutely getting more oxygen in circulation with 100% oxygen at a little bit of a deeper pressure. But they're already doing that. It's not a placebo. It's not a sham. It's not really a sham treatment. It has a physiological effect. So what are the outcomes of this study's been? Everybody gets better. Everybody gets better, right? That's getting the treatment and the sham.
So then it must be psychological if everybody's getting better. That's their argument, right?
Exactly. Everybody's getting better. It's a placebo effect. Everybody's getting better because they're just getting into a chamber. But even in the notes to these studies, they'll go, well, it's a little bit strange because these patients had stable symptoms for 6 months, a year, 2 years. Now they're better. That's strange. But it couldn't be the hyperbaric oxygen therapy because the sham people they got better too. So no way it could have been the chamber. It had to be something else. So you look at all the studies that have been done that have said that hyperbaric oxygen therapy is not effective. It's because they're comparing it to a group of patients that got a physiologically effective therapy. And actually, it actually raises a number of important issues, actually, in my world. Do you need 100% oxygen? Do you need hard chambers even? Because hard chambers versus soft chambers, hard chambers can go below 1.5 atmospheres of pressure. Soft chambers can't go below that safely. But maybe you could just be treating these patients in soft chambers over the long term. So there's a lot of interesting things that in my world, I go, wow, this is really cool stuff. But a lot of these studies were done, all of them were done with like less than 50 patients. So
what you're saying is that their studies using the just regular air at 1.3 actually opens up more possibilities for treatment because now you're seeing, okay, well, all of these things can be treated with just air under a soft chamber, and then these still need to be treated under a hard chamber with oxygen.
Right. The question is, what is the sweet spot? And could it be a very affordable, hypothetically affordable therapy compared to what I do mostly, which is the hard chambers? And it really opens up a lot of possibilities. And there's actually a recent study that was just done in Israel, because Israel is actually pumping out the best hyperbaric studies right now with traumatic brain injury patients. They did functional imaging of the brain so they could see the brain. And they did a hyperbaric oxygen therapy group at 1.5 atmospheres of pressure, which is about 15 feet of seawater, what it correlates to, versus a group of patients that didn't get any therapy. Okay, so they didn't get any hyperbarics. And they did something called a crossover control trial, where that group that didn't get therapy eventually did get therapy as well. And the results were dramatic. Everybody got better. But it was done in what we would define as a placebo-controlled crossover trial, which is the best thing that I think you can do in hyperbaric conditions. It's a bit complicated, but they basically start at 2 different points. Getting hyperbaric therapy, they're equalized out before you start to make sure they're matching, so they have a matched control in each group, and then you follow them around a time course period, because hypothetically nobody should be getting better anymore. These guys have symptoms that are stable. If you've had post-concussive syndrome or symptoms for a year, those symptoms are not going away, okay? But all these guys got better, and they matched them, and they showed that over time, these guys should not have gotten better, and they did. And what we're seeing now is, I think, a shift. There's been a couple states now, well, there's one state so far, Oklahoma, that has at least passed legislation to allow hyperbaric oxygen therapy to be used on veterans coming back from Iraq and Afghanistan. Now, the problem is that they're not paying for it yet. but they said that you could do it. So that's good. But I mean, we don't have any money to actually treat them yet. But I think there's going to be a tide, I hope, changing. There is now, I mean, it's a grassroots thing. It has to come from people demanding this kind of therapy being possible. I'm seeing it in my office every day. I'm seeing it in offices around the country that are doing hyperbaric therapy for traumatic brain injury. The dramatic improvements in these patients, getting them off drugs, getting them back to work, the amount of money that we're saving to get these people back to work. They're paying taxes. They're back to being productive members of society. Patients with stroke too, and other things that I do as well. Reflex sympathetic dystrophy, Lyme disease. I mean, the things that we can do with hyperbarics, getting people to be back productive members of society. I mean, the price that you could put on that is, you can always put a price on everything. That's what we have to do. I'm not an actuary, but that's what they do. But I mean, the amount of money that we can save is astronomical.
All right, why don't we talk about strokes, MS, RA, cognitive enhancement, et cetera. You've got a lot of things there that you can treat.
Right. So I mentioned stroke already. I mean, there's some recent studies. Another one just published out of Israel. Same thing. Dramatic improvements in patients. And when I talk to a patient about their stroke and what we think we can do as far as improvements, everybody always asks, can I walk again? Am I going to be able to use my hand again? And I never know from patient to patient how much better they're going to get. But what I can say is that I've never had a patient not improve in my own experience. Now, does that improvement mean that you can now toilet yourself? Can you now use your hand to carry your groceries? Maybe you can't use all your fingers, but maybe you can use your hand. I mean, is that a pretty dramatic improvement? I would say that is, but it's in the eye of the beholder. So I have to cage everybody's expectations. I don't know how much better people are going to get, but I do know that I've seen dramatic improvements in some people, and I've seen less dramatic in others. But I think to each person, I think it's been a blessing, because they have some function that they didn't have before. So rheumatoid arthritis is an interesting one, and I think that comes back down to inflammation or decreasing inflammation. MS, same thing, decreasing inflammation. These two particular disease processes are chronic and degenerative. So I think the way hyperbaric oxygen therapy needs to be used in their case is as a long-term maintenance therapy, probably after initial set of therapy in the beginning, to make sure you decrease that inflammation enough. Because what it seems to be is that once somebody goes through hyperbaric oxygen therapy, gets a full course of therapy, which, by the way, is a couple months in length, and it's a pretty intensive therapy, our bodies seem to be primed to get hyperbaric oxygen therapy and those effects at a much shorter course down the line. So, for instance, a typical course of therapy for MS or for rheumatoid arthritis, for stroke, for TBI is 40 treatments. So we're talking Monday through Friday with the weekends off for 2 months. So it's a long, intensive course of therapy. And when I describe that to patients, I have to tell them, look, I know it's intensive. I know it's a lot. But if you can do it, the effects can be dramatic. And the amount of time and life that you might be improving is worth the effort. The amount of money you're going to spend potentially as well. And the reason why you need that much therapy is that hyperbaric oxygen therapy is a cumulative process. It doesn't happen right away. Blood vessels don't grow overnight. DNA changes, is what hyperbaric oxygen therapy is doing, happen over long periods of time. So you need that cumulative process to get to the point where you can get a sustained improvement, and then get to the point where you get your body recovering on its own. And then also being extremely primed for hyperbaric therapy going down the line over time. So these chronic neurodegenerative conditions like MS, like strokes, like traumatic brain injuries, like vascular damage over time, that's what aging is vascular damage in our brain over time. Those patients, and that leads to sort of the question of cognitive enhancement as well. What's happening with cognitive decline over time? If you look at somebody under an MRI scanner that's over 50 years old, what a radiologist is going to tell you is that they have microvascular ischemic changes. And what that is that your vessels are dying over time. your vessels are getting damaged, your brain is now shrinking, and the neurons are dying. So what hyperbaric oxygen therapy can do is it can regenerate those vessels. It can regenerate tissue that's not fully dead and make it alive again. So that's how I think hyperbaric oxygen therapy can be effective in neurodegenerative disorders and in things like cognitive enhancement by preventing those vessels from dying, or if there's any at-risk tissue, for improving the vascular flow. And also, there's an area in the brain called the hippocampus. Have you heard of the hippocampus?
Sure.
Yeah. So what the hippocampus does is it basically takes short-term memories and makes them into long-term memories. And in patients with traumatic brain injury, we see this all the time. Their hippocampus is shot. They'll be able to tell you exactly what you said, but 10 seconds later, it's gone. Okay, because your hippocampus and your frontal lobes, because of your executive function. Number one, you can't keep it in your frontal lobe in your memory, but the second, you can't bring it into the hippocampus and bring it into a long-term memory. Blood flow to the hippocampus is dramatically improved in hyperbaric conditions. And we see this in normal people too. So we think that's the way hyperbaric oxygen therapy is really helping these patients, cognitively improving their abilities to think and their executive function, as well as their ability to turn short-term memories into long-term memories using that. And the hippocampus is probably the most neuroplastic area in our brain. By neuroplastic, I mean is that we're constantly forming new neurons, constantly making new memories. So, I think that the general thought was that we stopped forming new neurologic connections when we were 30 years old or something, and we were just degenerating. But that's like the furthest thing from the truth. And under hyperbaric conditions, or even under functional imaging, we can see that. So that's where hyperbaric oxygen therapy is really going. Go ahead.
I was going to ask, and in your practice, do you couple all of this with, diet and things like that, all at the same time, so that they're sort of doubling up? Or I suppose you're saying that the oxygen therapy is more effective, but then if they have the diet and everything to reinforce it, it would go a long way as well, I would assume, right?
It's amazingly synergistic for so many reasons. And I think the first reason, and I think you can understand this, is inflammation.
Sure. So you're getting, you take the wheat out of the diet and the grains, which lowers the inflammation. You put them on oxygen, which lowers the inflammation. You put them on high fat, which lowers the inflammation. And so, yeah,
Right.
you're right.
And it's also about cellular metabolism, how our cells work. And our bodies, the first year or two of our life, actually, our brains just work on ketones, actually. They don't even use glucose as a source of energy. So we have this other system in our brains that none of us really use after a couple of years, unless you're on a ketogenic diet or a low fat or a high fat, low carbohydrate diet. And in fact, in Alzheimer's patients now, this is becoming a medical therapy, just like it's been used in kids for seizure disorder, for epilepsy, ketogenic diets, because our bodies are primed to use ketones and fats.
No, I was going to ask you about ketones. Would you explain what ketones are? Oh, and you know what? Before you do that, I think you had meant to attach a couple of files that I didn't receive. What were, did you want to try to resend those or talk about them now, and I'll show them on screen?
Oh, I'm not sure. I think maybe what I sent you was just a list of the FDA approved and the investigational indications, because you could talk hours upon hours about all of this.
Okay.
And I thought it'd be nice to have those. I mean, you can maybe post them. I could try to find them real quick and send them to you if you want.
Sure. Well, we can just talk about them, or if you'd like, and I'll just show them on the screen right here, and then go into ketones or ketones, and then that. Either way.
Yeah, sure. So I could do that. I could talk about ketones while I try to find that real quick for you. So ketones are basically one of the ways our body can use energy. So there's a couple different ways our body can make energy or use energy. Glucose is the most common. Ketones is the second most common, although we don't realize that. Ketones are the breakdown of our protein and fat metabolism. Okay. And our bodies are primed to use either, depending on the what's available. Our body is going to use first
So
is,
what
sorry, go
you're
ahead.
sorry to interrupt you. What you're saying is that somebody who is on a high wheat, high sugar diet, they're going to be using a lot of glucose, I would imagine, and then somebody who is on a high fat diet, their body would switch over to using ketones. Would that be accurate?
That's exactly right. And our
Okay.
bodies can use, sorry, go ahead.
No, I'm just okay.
Yeah, that's exactly right. So what our body's going to first do is burn the glucose that we have. Um, Most of us have plenty floating around because we're eating it and drinking it, um, inhaling it all the time. um, but the ketones are a little bit harder for our body to first get out of the areas where they're stored. But once we get our body transitioned over to ketones, they're just as effective and probably more effective at giving us a sustained source of energy than glucose is. Glucose is really good for the fight or flight stuff, for getting us away from the lion, getting us away from the tiger. But the ketones are really what sustain us over the long term. And I think that's what's really going on. I'm trying to find this, and I don't know where it is here. Um, Sorry, I'm working on trying to find those files for you.
That's all right.
Uh, but in the brain, this is where the cool stuff is happening, right? Because now we understand that the metabolism of our cells can work on this entirely different pathway than we realized on a ketogenic pathway. So I'm just going to focus on you instead of trying to find this, Jan. So
All right, no problem.
um,
We can just show it on the screen later, but yeah, let's just.
yeah, I'll try. I'll find it. I'm sure it'll pop up. But anyway, so in Alzheimer's patients and in all of us, we have the ability to use ketones as energy, and where that energy gets used is in the mitochondria of our cells. Um, what hyperbaric oxygen therapy is doing is revving up our mitochondria, making them supremely more effective, making them much more of a powerhouse than they already are. So their cellular metabolism, making energy, is revved up dramatically. So you add ketones to that. It's like a synergistic, like it's a parade. It's like it's fireworks, man. It's great. And what's happening over time is our ability to use glucose actually deteriorates as we get older. Our glucose metabolism gets worse. So we have this other system that we can use instead of glucose, which is these ketones, that doesn't seem to get any worse. In fact, it's always there. It's always waiting for us to use. And all we need to do is harness that power to rev up our
Eat
mitochondria.
lots of butter.
Yes, butter, fat,
Right.
coconut butter, whatever you
Sorry,
want.
go ahead.
No, butter's good for you. I like butter. My kids like to eat the butter just straight off.
Well,
Although we,
that's, actually, in our house, my son, he can go to the fridge and get butter anytime he wants because actually butter and fat is one of the number one things that kids, young children steal.
they need it. They
Right.
need it.
Right.
You know, and
Exactly. And anytime you crave it, just go get it. You don't need to. When I was a kid, I had to sneak to the kitchen. I remember as a kid all the time sneaking to the kitchen to steal butter.
oh, really?
Yeah.
Yeah, butter was not something that I would have by the stick, but I think your kids probably have it by the stick, right?
Well, it's like the butter pops on South Park.
Right. That was a great episode, by the way.
It was.
Turning the triangle upside down was probably one of my most favorite TV moments ever.
Yeah, yeah,
Loved it.
I agree. It was I was yeah, it was absolutely hilarious. That was one of their best episodes, I think. At least for those of us who really know this stuff and have followed it for a while, and you even more seriously than I, for sure. But it was pretty hilarious. So everyone, go watch gluten-free Ebola from South Park.
Yeah, awesome episode. Yeah, but I mean, what it comes down to is that we have this whole other system that most of us didn't realize that we had. The ability to metabolize, use our mitochondria, energize our cells, make ATP, and regenerate tissue. I mean, it's amazing stuff.
What you're actually explaining right now, and for the audience who has started the paleo or Weston A. Price or Dave Asprey type diets, etc. When you get on that high fat diet, and especially with the bulletproof coffee, you feel over the first couple of weeks this sort of switchover. Something's happening with your body, the way it's utilizing the fats. And so this would actually be, the real thing that's going on there between the glucose and the ketones is your body is learning to switch off of the use of glucose and go on to ketones.
It's less of an up and down, right? It's more of a like it's
Oh,
just straight
it's
out.
absolutely. I mean, when you're on a high grain diet and all of this wheat and stuff, yeah, I mean, there's this constant up and down crash. Whereas when you have a lot of fat in your diet, your energy level is stable all day. I sleep a lot better than I used
Right.
to. That's for sure.
Yeah. And it's amazing stuff. I mean, you add on to it ways to improve your mitochondrial function, like using hyperbaric therapy. And it's what I've noticed is just like an amazingly synergistic event. I mean, these guys, especially post-stroke, post-TBI, I changed their diet. I put them in hyperbaric conditions. It's like fireworks, light bulbs, whatever you want to call it. Their brains start just functioning so much more. It's amazing to watch, and I think they kind of look at me. They just like their eyes are wide, and they're like, "This is amazing." And we add, and one thing to mention is that you don't need to be super ketogenic for this or super like, you know, when I've talked to patients about it. I mean, just trying to add in the high fats and staying on the low carb, and you don't have to worry about, obviously you can check your ketones, you can do all that, but I mean, that can make you crazy too. The idea is just to do how your body feels is most optimal, right? So you
Yeah.
start doing more high fat, more low.
And sorry to interrupt again. I noticed right away after doing this for almost 3 years now. I noticed right away when I don't have enough fat in my system. It's you feel slower, you feel more tired, and it's not like you eat a few crackers or something, or you drink a soda pop and you get that quick rush, but you have that sort of slow feeling all day.
Yeah, it's a very different feeling, and this is just. I mean, in a regular person, it's dramatic. In somebody that has brain injury, it is exponential because there's so much capacity that's being unlocked. The problem with our brain, if there's one problem, is that our brain is getting maximal amount of blood flow that it can in any one period of time. Your brain and your heart will keep oxygen and keep blood flow there before and kill everything else off before you'll kill off the rest of your organs, your limbs, your kidneys, whatever. But it'll keep your heart beating and it'll keep your brain active. Because if you lose blood to those two places, you die, right? So when you're trying to heal one of these brain injuries or a stroke, it's very, very hard to do. In fact, that you look at somebody's brain under these SPECT scanners, you can see pocked areas of the brain where the brain tried to heal itself, but it couldn't do it because no matter how much blood you try to get to, how much you try to heal it, or the body tries to heal it, it can only do as much as it can do because you need to increase oxygen flow. You need oxygen to that tissue. You put them under hyperbaric conditions. That's how you can do it. You can get blood flow to those areas. You can get those cells to regenerate. And you add in things like we're talking about with dietary interventions, changing the way these cells metabolize, and it's like a 1-2 punch.
And so then, aside from the ketones, you would also have the additional benefit, especially with brain injuries, of the fat, which the brain burns, and the cholesterol, which what the brain is like 70 some percent cholesterol, right?
Right,
And
absolutely.
and so then you would add all of this together, and it makes actual sense.
Yeah, it's like you put it all together in your brain. You're like, why is this not?
Well, you put it
Why?
together in your brain, and you go, "That's why this is not."
Yes, yeah. So I mean, you're right. So neurons need fat. I mean, they need fat to myelinize. So I mean, every different aspect from the cholesterol to the fat. I mean, it's all synergistic, and and it's just amazing to watch, really, when it all happens. You give the brain what it needs. You give it the blood flow to get everything there that it needs. You give them the blood vessels. You give them the stem cells from the bone marrow that are being harnessed when you're in hyperbaric conditions, and it's awesome. It's why I do what I do.
Very cool. All
Yeah.
right, so why don't we talk about the difference or the comparison between soft and hard hyperbaric chambers?
So the hard chambers go to deeper pressures. The hard chambers can go down. The ones that are used in hospitals can go down about, I think, about 6 to 8 ATA, atmospheres of pressure. So multiply 8 by 33. That's how far down they can go. Um, the ones that are usually used in offices like my own usually go to about 3 atmospheres of pressure, and they're used for any number of all the FDA approved indications are for the hard acrylic chambers. This is acrylic glass, by the way. And so there's two different pressures we treat patients usually. I'm putting my hands here, you can see here. So there's one pressure that's sort of a more shallow pressure for neurologic injury, because brain tissue is actually very sensitive to oxygen. It's very sensitive to pressure. So it doesn't need as much pressure and oxygen to get the blood flow. These studies were done in the 70s, actually, that the optimal blood flow enhancement using hyperbaric conditions is somewhere around 1.5 to 2 atmospheres of pressure, which is about 15 to 33 feet of seawater. Okay. So you have a question about that?
Oh, I was just going to say, so just a little bit deeper, maybe 2 to 3 times deeper than your average swimming pool,
Right.
essentially.
Exactly.
Just
Yeah.
trying to put it into a, something that people can visualize.
Right. So most peripheral wound healing needs more pressure than that. Needs about 2 to 2.4 atmospheres of pressure. So about 33 to 45 feet of seawater. Okay. So when I'm talking about peripheral wounds, I'm talking anything outside of your central nervous system, anything outside of your brain and spinal cord. So like for a diabetic foot ulcer or foot wound, an acute injury to one of your limbs, like a surgical procedure that you're looking to improve the healing time, you need more pressure than than 2 to 2.4 atmospheres of pressure. Now, the soft chambers only go to about 1.3 atmospheres of pressure, which again is about 12 to 15 feet of seawater. These chambers also do not have 100% oxygen in them. They have compressed air, which is the normal composition, about 20% oxygen, about 80% nitrogen, or about 75%, and the rest other stuff. So the soft chambers can only go to about 1.3, and they use compressed air.
And not only that, if people, under certain treatments, they could afford one of the soft ones and have one at home or something, right?
Right. So the soft chambers
Okay.
can be used as a household. They're much safer because they don't go as deeper down, and they have compressed air. Exactly, they can be used at the house. They can be modified, some of these chambers, to go down deeper, although I don't recommend that. As a physician, I cannot recommend that. Okay.
Could the soft ones be used in a pure oxygen environment or no?
So the short answer is yes. The longer answer is that it's not safe to be doing so outside of a medically supervised medically supervised conditions. And the reason for that is that because when you have 100% oxygen anywhere, oxygen's a flammable gas. Okay, you don't want to be messing around with oxygen in a 100% environment unless you know what you're doing. Okay, and that's something that we take very seriously. But where I work, and most hyperbaric chambers, I hope all of them, the ones that I know of, take it very seriously, having 100% oxygen anywhere. So I don't recommend that you modify your chambers. Although done in a medical setting, there are some facilities that I'm aware of that use chambers that can be modified up to about 1.75 atmospheres of pressure safely if done with the correct supervision. So the major difference is the pressure and the oxygen. Those are two major differences between the soft chambers and the hard chambers.
I got to ask you, have you ever considered treating former alcoholics, et cetera, and any brain damage that they may have had?
So there have been some studies done in Russia. Shocking, lots of alcohol use in Russia, I guess. That there is some indication that hyperbaric therapy may be effective in acute withdrawal, actually. The long-term maintenance for addiction, nobody really knows.
I mean, not for the addiction itself, but for treating brain damage from the alcoholism itself, post alcoholism.
Well, that's a really good question. I don't know of any studies for that exactly, But you're right. The idea is sound because what is alcohol? Alcohol is a toxin, so it's a toxic injury to neurons, toxic injury to your brain. So hypothetically, I think it could be something that should be studied. I mean, I haven't had any patients that have come in for that particular indication. I mean, you have these severe side effects from alcohol, something called Korsakoff syndrome or Wernicke's encephalopathy, where these guys have no short-term memory, right? They can't make, or they have word salad, things just coming out of their mouth. They can't talk, So it would be actually really interesting to set up a study with these guys to see.
I suppose you could even, you just reminded me when you said that, like Crutchfield-Jakob syndrome, mad cow disease, stuff like that, where it's just holes in the brain. I don't know if they've looked at that. Remember
Yeah,
the 90s scare and all of that?
Yeah, I don't know anything about prion disease, but what's happening, to some degree with hyperbaric therapy, is that we are modulating neurotransmitters, of course. So, and I think when you're talking about addiction, we're talking about PTSD and sort of the neurotransmitter changes that probably are happening. I think that hyperbaric is probably modulating those. We just don't have the evidence to tell you that. But I think that's maybe why it's actually occurring or why it's helping in patients going through acute withdrawal. And the studies were small, they weren't controlled, of course, but these patients seem to have less withdrawal when they were in a hyperbaric environment, probably from neurotransmitter modulation. But again, I don't know for sure.
All right, what about HBOT protocols?
So I was alluding to a little bit before, hyperbaric oxygen therapy is not a one-time thing for the most part. It's a long-term therapy, or at least a course of therapy. Now, depending on the indication, so if it's an acute injury, now if you just had, for instance, like plastic surgery to fix your nose, right, and you want that to heal quicker, you probably need about 3 to 5 therapy sessions to make that healing happen quicker. Maybe about 30 to 80% more effective in healing. There's actually a study done in plastic surgery literature showing that the bruising happened and it went away quicker, the scarring was less. And that's not an FDA approved indication yet, but I mean, again, it's a nose. But if you think about it as like your hip or your knee that you just got replaced, the idea is that an acute injury doesn't need as much hyperbaric therapy to get you over that hump, to decrease inflammation, to decrease scarring, to increase to decrease the amount of recovery, get you back on the field quicker, get you back to your office with a huge thing on your nose or whatever it might be. But for things that have been going on a long time, for chronic inflammation, for chronic neurodegeneration, things like traumatic brain injuries or strokes or diabetic foot ulcers or radiation injury, the things that are FDA approved right now, that takes time. It takes a long period of time. So therapy for these particular indications are somewhere between 30 to as many as 80. For some severe traumatic brain injuries, patients have been treated for 120 therapy sessions. These sessions.
So that would be like once a week for 2 years or something like that.
No, this is we're talking Monday through Friday.
Wow, got it. Okay, so you're talking about, okay.
So they're usually done in 2-month blocks, okay? So you don't want to get more than 40 therapy sessions in a row for the most part. And the reason for that is that you have to worry about oxygen toxicity over time. Very rare, but this is something that if you're getting a ton of therapy, that is a possibility. That's why I think the major role for these soft chambers actually is for the chronic maintenance of neurodegenerative conditions, because you're not going to need as much oxygen over time to treat them once you get initial therapy at a higher oxygen environment, is my sense of things. So over the long term, you need less oxygen, and less oxygen is going to be more beneficial than more, because you could potentially treat yourself with too much oxygen if you're doing it for too long a period of time over too long a time course. But anyway, so the hyperbaric therapy protocols usually are Monday through Friday with the weekends off for anywhere between 5 to 40 therapy sessions, and then sometimes more, sometimes another 40, depending on the indication. So it's a pretty significant time commitment. In the chamber itself, you could be in there for anywhere between an hour to an hour and a half at a time.
Go ahead, sorry.
all I was going to say is that in the chamber, for the first 10 or 15 minutes, you have to worry about your ears because you have to be able to pressurize your ears as you go
Sure.
down and go up. But after that, once you get down to the pressure that you're going to be treated at, it's very relaxing. You just watch TV, you watch movies. It's quite comfortable.
All right, so let's. I want to step over into something a little bit taboo.
Okay.
The FDA may get upset about this, so you can use all the caveats that you need. But okay, so we have a traumatic brain injury that is also tied to stomach disorders, which would be something like autism, and so autism is very often tied to many different stomach disorders and things like that. So obviously there's something going on in the brain there too. So now, would it be incorrect to suggest that oxygen therapy coupled with a high fat, low carbo diet and utilizing the ketones, that it would in fact help many children with autism to possibly even recover from that?
So before I say anything, what I should have said in the beginning and what I should say now is that I am a physician, but all what I'm saying today is my own personal opinion. What I would always recommend is that anybody that is looking to get therapy, or looking to do anything, should consult with a physician in person or maybe by Skype or whatever to talk about their particular situation. Everybody is different, okay? And a lot of what I've been speaking about today are things that are not FDA approved, what I believe have a lot of data behind them, and what I've seen in my own personal practice have been very successful. Now, so go talk to your doctor, or go find a doctor that's willing to talk to you about these kind of things. So when you're talking about autism, when you're talking about ketones, and you're talking about your gut, you are stirring up a whole bunch of stuff, as you know.
Yeah,
Uh,
that's all of the key points that would raise absolute hell in the whole healthcare system.
Right. You can name more. We don't have to, please. But
Well, I have interviewed Wakefield before, if that helps.
oh, you have.
Yes.
Andrew Wakefield's yeah, he's a really interesting guy.
Yeah.
I've heard him speak a couple times. But what I would say was this: there is a spectrum of diseases that are going on with kids' brains. Okay, anything from a little as mild inattention to severe autistic spectrum. Something's going on with these guys' brains. And I think part of it, I think, is inflammation. Okay. And I think most people would say that inflammation starts in the gut for a lot of people.
That
It
would
starts with what
that,
we're eating.
that would make
So
sense. Yeah.
if you decrease inflammation by what you eat and with hyperbaric therapy, there is some anecdotal data and some uncontrolled trials out there showing that using hyperbaric oxygen therapy plus a comprehensive approach to autistic care can be an effective adjunctive modality for these patients. Okay. And we can actually, we see this in my office, we see this around the country. I don't allow these patients to get treated unless they're getting comprehensive care with a physician that is well versed in autistic spectrum care. Okay, so these patients are treated in offices, hyperbaric offices, and do see significant improvements. But most of it's anecdotal right now. What I think, when it comes down to, I said this over and over again, it is the inflammatory cascade that hyperbaric oxygen therapy can be helpful for. It's not the solution, but it becomes a synergistic stimulus where our bodies allow ourselves to heal because we're decreasing all that inflammation, so.
All right. What about the cost of hyperbaric treatment?
So the way I like to frame the cost of hyperbaric oxygen therapy is in the long-term effects, what kind of effects we're going to have down the line to prevent you from all these other complications that you may have. If it's a diabetic foot and you need an amputation, that's going to be a significant cost to you over the long term. If it's a radiation injury and you have, if you have necrosis of your brain and you can't use your hand and or you can't think and now you can, those are significant improvements. If it's a stroke and now you can, toilet yourself or you can carry your own groceries, can you put a price on that? I need to say that because hyperbaric oxygen therapy is expensive. In the hard acrylic chambers, the things that I use, every therapy session costs about $200 to $250 per session in the Bay Area where I live. Across the country, it can be as low as $100 a session. And you're talking about 40 sessions, so you can do the math. It's not a cheap endeavor.
Well, and just a rent for a small flat in the Bay Area is like $3,000 a month. So,
right. So it's just not a small amount of money. Now, I try to couch that in the idea of what you're saving in the long term. But again, it is an upfront cost. There's no doubt about it. Now, if you have an insurance indication where insurance is going to cover it, if you get it at a hospital, each session is going to be about $2,000. Okay, your insurance hypothetically will cover most of that unless you have a gigantic deductible. Now, if you get that same dive that's covered by insurance at my office or at an office around the country that's what's called a freestanding clinic, not associated with the hospital, it's going to cost $250 to your insurance company. Okay, so hypothetically, it's going to cost you less down the line because your copays, your deductibles are going to be less too. So if you can get hyperbaric therapy outside of a hospital, it's better for the healthcare system, if you care about that. And it's also better for your bottom line because you're not going to be charged $2,000 a session. You're going to be charged somewhere between $250 and basically $550 a session. So a significant difference in price. So I would recommend if you have an indication for hyperbarics. Oops.
We're still there. It sounded like it picked it up and just sped you forward, so we'll be able to fix it in the end. Go ahead.
Sorry about that. Yeah, I had some sort of no worries. So anyway, if you have the choice to go to one that is in an outpatient setting that's going to cost you less money. And then if we're looking for things that are not covered by insurance, some of the investigational indications, you can only get these treatments at an outpatient facility that's not associated with a hospital. Hospitals can only treat you if you have an FDA-approved indication. So if you ask NYU or St. Francis Hospital or another hospital to treat you for, say, stroke, they'll say no, first of all. But if they say yes, they're going to say, well, it's going to cost you $2,000 a session. So I don't recommend that.
All right, and we've talked about all of the benefits of HBOT. What would be some of the side effects? Are there any?
So actually, I forgot. So the soft chambers, I should mention, like we talked about before, they are less money. So you can rent these things for your house. They can be used on a personal basis. You don't need a physician monitoring you per session. Although you do need a prescription from a physician to get the chamber itself, by the way.
Oh. Okay.
Yeah. Unless you buy, there's other ways to get them. But
now, would a physician like you that has your own treatment center, would you be able to write a prescription for somebody to be able to get a home one?
So any doctor can write them.
Okay.
Me or anybody else.
All
so
right.
It doesn't have to be me. So the side effects, hyperbaric oxygen therapy is one of the safest medical treatments out there. As I said, it's been around since the 1600s.
Yeah, you're back. Go ahead.
Sorry. The amount of complications from hyperbaric oxygen therapy are minimal. The most common is the eardrum. So when you're in a chamber, you need to be able to pressurize your ears. Make sure you can decompress your eardrum. If you can't, they can pop. But it should never happen because if you're in a medically supervised unit, it shouldn't happen. Okay, because they can watch you, they can see what's going on. They can make sure that if you have any pain, that you can stop the compression and you can make sure that they can pressurize their ears before you go any further. Okay. Now, if you don't tell somebody in the chamber, if you're the person in the chamber, don't tell the tech that's watching you that you have pain, then your eardrum is going to pop. But if you don't do that, if you tell them, then it's fine. You don't have to worry.
Right.
Okay?
Yeah. I live at 5,000 feet, and it's just you driving up and down the mountain. You have to be able to do it. And if you get a cold or something in the wintertime, oh boy, does it hurt like hell when you go off the mountain.
I know.
It's incredible.
Right. So, and if you do that in a hyperbaric chamber where you're going much deeper, or it can cause, your eardrum to rupture. So a
Right.
couple of the things you need to worry about, but uncommon, increases insulin sensitivity. So basically increases the amount. Basically, you want to eat before you go in the chambers. That's all. So because your blood sugar is going to drop a little bit. It'll also affect your vision in the short term, especially the deeper pressures, but that your vision goes back to normal. You don't have to worry about getting new glasses. Okay. There's a couple rare side effects, but I usually recommend that patients, even if they're thinking about soft chambers, get treatment in a hard acrylic chamber first, just to make sure that they're good, that they have no trouble, that they're medically supervised, and then as long as that they're doing okay, then they potentially can get their own soft chambers to use at their house. Because if you're in your own house doing them, you don't know, things can happen, and nobody else is there to help you. It can be a little bit more dangerous.
All right, Dr. Scott Sherr, what would be the single most important takeaway point that you would like listeners to remember from this episode?
One point. That's a hard one. What I would say, I guess I keep going back to inflammation. That hyperbaric oxygen therapy is a modality that is synergistic with any anti-inflammatory, protocol. But what we're doing in hyperbaric therapy is decreasing inflammation, decreasing swelling. And when we're doing that, we're allowing the body to heal. So what hyperbaric oxygen therapy is healing wounds no matter where they are, whether they're in your brain, whether they're in your cell itself, whether they're in your toe. Hyperbaric oxygen therapy is healing wounds. And it's doing that by modulating DNA, by affecting our cells at their basic mechanisms. And I think it can be used as a synergistic approach to healing in numerous types of disease ailments. And that's why I think as an investigational tool, the data in all these conditions, the ones I've spoken about, including some others like reflex sympathetic dystrophy, Parkinson's disease, there is a role for it because we're healing wounds. Okay, that's what it comes down to. So that would be the takeaway from hyperbaric therapy: is that we can heal wounds no matter where they are, and we can heal them more effectively a lot of times than our body can do on their own, especially in the brain, because the brain has such a hard time healing wounds because of the limitations in capacity to increase blood flow.
And just real quick, they used to believe that you couldn't heal wounds in the brain, isn't that correct? And that's just because of being able to get the fats and the oxygen in there.
There was some thought that you never fully healed your brain after an injury, and I think we've dispelled that myth to a large degree over time. What I think hyperbaric oxygen therapy is doing is definitely making that even less so as an issue. I mean, I do think that patients with traumatic brain injuries, with strokes, I don't think we're getting them there 100%. I think we're getting them there dramatically more than they could before. But so we are healing wounds. Maybe not 100% all of the time. Maybe not 100% any of the time. But we're getting close, much closer than we were before, which I still think is quite dramatic.
And Dr. Sherr, your website, do you have a book?
No book yet. Right now, my website is the best place to get a hold of me is integrativehbot.com, integrativehbot.com. And you can also follow me on Twitter at Dr. Sherr, DRSHERR. And those are the main places to find me. I also do consulting work at the San Francisco Institute for Hyperbaric Medicine, at this other company in New York called Hyperbaric Medical Solutions. They have 2 sites in New York, another one opening up in New York City, which is very exciting because there's only 2 chambers in all of New York City, if you can believe that, for 13 million people. So I think there's a very large untapped market there across the country, across the world, really. But the U.S., we're going to get up to speed. It just takes us time, like our internet speed. It just takes time, right?
Well, at least we're not in Canada.
To
Yeah.
each their own. Canada's
Yeah,
a nice place for some people.
Canada has the worst internet anywhere.
Oh, it does.
Yeah. Yeah, like third world countries have actually better internet than Canada does.
I wonder why that is.
And it's gotten worse recently. I have a lot of friends in Canada. It's always a problem. All right, Dr. Sherr, that's a wrap. Unless you had anything else to add.
Thanks so much for having me on. It's really been a pleasure to be here, and I look forward to completely reading your expose on the CIA and
What's
the
in a
drug
name?
experiments in the
Right.
1960s.
The what's in a name paper that I just put out. Well, I'll be happy to hear your feedback. I've gotten some really nice feedback. I had a psychologist write me the other day, wonderful reviews about it. So good stuff. And all right, so that's it, and I'll kill the recording here.